Months into a pandemic, I get that, right?
We can see your screen just great.
Okay, perfect. Well, first off, thanks to the Colorado Cancer Coalition and the leadership and all the members and attendees for allowing me to give a quick overview of Rocky Mountain Oncology Society. My name's Scott Kono, and I'm a medical oncologist. I work at UC Health in Cherry Creek, and I'm currently president of the society. So I'm hoping to give a little bit of an overview today, and feel free to ask questions or ping me as they come up. So the Rocky Mountain Oncology Society was established in 1991, and this is the largest oncology professional society or organization that we have in the state of Colorado. And it comprises quite a few members, fairly broad-reaching. We have physicians, including medical oncologists, radiation oncologists, supportive or palliative care doctors, some surgeons, as well as APPs, RNs, pharmacists, social workers, and many other allied health professionals. So we really do try and represent the whole spectrum of providers caring for patients with cancer in the state. We are a chapter member of the Association of Community Cancer Centers, or ACCC, as well as a state affiliate of the American Society of Clinical Oncology. And what that really means is we can serve as a sounding board and a liaison for both local and national issues to our members, or bring pertinent issues up to, again, advocacy groups more on a national level. So it's nice from a local perspective of cancer care that we try and improve standard of care, which we'll talk about within the community, but also on a broader level, we try and serve as advocates for cancer care in general. We at RMOS, along with 20 other members, comprise the Oncology State Societies, which we'll speak about a little bit later in the presentation. So what is our mission? Our mission is pretty similar to that of the Colorado Cancer Coalition in many respects. So we do want to improve the quality of cancer care available to the people of Colorado. We also provide a local and national voice for cancer care teams and the patients that they serve, as well as trying to advancing the standard of care, maintaining the standard of care within local community practice. And that's largely done through educational symposia and strongly supporting oncology education throughout the state. The RMOS also serves as a venue to promote communication and relationships among cancer care providers in the state of Colorado. That's one of our biggest resources, I'd say, and probably most fun things that we used to do in the non-COVID world. And we're modifying pretty well in the COVID world to keep these lines of communication where I can see physicians or nurses or social workers who work outside of my group and talk about best practices and issues that they're facing. So that's a great advantage of the society. So who are we on a leadership level driving this forward? There are elected members, and we do serve generally 2-year terms, but the people who are there consistently are the executive office. And so Nicole Dravitt is our executive director. Don Cooksey is our senior manager for corporate sponsors. And it's a good time to really acknowledge the importance and give a quick thank you to all of our corporate sponsors, because without their support, we'd really have a hard time getting any initiatives off the ground. Cheryl Kim, she's an associate for membership, as well as Amanda Impellerizzi, who is integral in relations management. As far as our local board, like I said, I'm currently serving as the president through the end of this year. Madeline Kane is our secretary and treasurer. Tom Purcell is our immediate past president. And you'll recognize probably a handful of the names on the list here. It's a nice group. It's a great group to work with. But importantly, it has a fairly broad range of coverage on experiences and backgrounds, as well as practices that we serve. We represent UC Health, University of Colorado, Rocky Mountain Cancer Centers, SCL Health, Kaiser Permanente. So we do get a pretty good sampling of other practices throughout, throughout the state here. So what do we do? As I mentioned, we serve to primarily educate. So we have a handful of educational symposia every year. They're usually conducted by thought leaders in their fields, and they're just fantastic talks. They range from precision medicine to new therapeutics to when the Medical Aid in Dying Act or bill came through Colorado and was legalized, we had a fantastic talk with one of our palliative care docs. We have leadership and training, as well as presentations on that. So we really try and keep the educational series broad, and we really rely on our members to guide us on topics that interest them or that are pertinent in the time. One of the things that we're most proud of is this Allied Health Professionals Award. So this was created to further the development professionally of our associate members. Every year, we give out at least 10 awards of $2,000 each to associate members to further their educational endeavors, whatever they may be. And that's been really great to work with some of the associate members and allied professionals where they may not have funds to go to a conference or for any oncology specific engagement that they're looking to do. And this allows them to really be an active part in the society, as well as help their local practices. We are, again, an advocacy group as well. So we recently were involved in urging congressional leadership to help or support Medicaid patients and paying for standard of care on clinical trials for those patients. So we try and work with the American Society of Clinical Oncology and ACCC on any issues that are coming up. On our website, which you'll see at the end, we do have online educational resources as well as webinars. There's quite a few things that you could browse through. And one fun thing that we do every year is an annual professional development panel for residents, but mostly fellows who are thinking about a career in oncology. And we have a panel of doctors from academics, from Sarah Cannon, phase 1, from industry, as well as Kaiser or Denver Health. And it's just an informal Q&A session where they can learn about the different practices and make more educated decisions on how they want to move their career. Where are we going in the future? Well, we're really expanding our charitable donations and contributions to both oncology and non-oncology groups, which is exciting. We are expanding our membership base, so we're still looking to make this not only as medical oncology focused, but really involve more radiation teams and surgical oncology teams, as well as associate members. We're always looking to expand our membership, as well as educational opportunities outside of the Denver metro area. I think it's important to recognize that a lot of cancer care occurs outside of these big urban areas, and we do need to support our local oncology teams and the patients that are out there in more, again, rural areas of Colorado. There are some venues where we're increasing our interaction with other state societies. As I mentioned, there's 20 societies out there that we can interact with, share best practices. Finally, we're looking to expand the digital footprint. How do we give our services and support our oncology teams and patients in the era of COVID? And we're really doing what everybody else is doing and trying to leverage online resources, webinars, and Zoom meetings like this one. So just a couple of quick plugs. I know you guys have a busy day and my 10 minutes is just about up here. So we do have a couple of great events coming up. We have an Oncology State Societies at ACCC. It's a 2020 virtual symposium. It's on November 13th. 8 to 3 p.m. And there's quite a few topics that are going to be covered. Again, these are by thought leaders and experts in their field. Some of the topics I just threw up here, like castrate-sensitive prostate cancer and new therapies with that, and telehealth. We're going to give a highlight session on ACCC, the national conference. There's changes in coding, so evaluation and management code changes. It will be presented by a representative from the American Society of Clinical Oncology. And then there's going to be a really fun talk from a professional speaker who is going to go over managing stress with humor. So we're looking forward to that one. And again, that's another good venue for us to organize and work with our other state societies. A couple other local, we have a webinar with health, talking about health disparities in cancer care with Dr. Okiyama on the 21st of January. And, you never know, times are changing quickly, but we do have it on the books for our 2021 annual conference to occur at the Sheraton downtown in September of next year. That's a great conference, and it's just a great networking opportunity and informal, but usually 2 high-powered talks at that talk. So our website address is kind of long. It's better just to Google RMOS and you'll find us. But if you really do have questions, feel free to email myself or Nicole Drabit at ndreabit@accc-cancer.org. And we can make sure that you guys have that information if there are any questions or anything we can do. So finally, just wanted to say thank you guys for your time. Thank you for all the advocacy that you do at the Coalition for Patients and Families. So I'll cut off there. I know I'm pretty tight with time there. Thank you.
Thank you. It was great to see all of that. And you can just stop your screen share. I had a great conversation with Nicole last week about other ways that the Coalition can work with Rocky Mountain Oncology Society. So